Welcome to the Athenahealth customer webinar. Today we're going to be discussing CallMyDoc and how it helps improve patient access to their doctors, and at the same time cuts the amount of time and cost that you need to spend dealing with phone calls. So what we're going to go through here is a couple of different things here. First of all, we're going to give you a little bit of background about CallMyDoc and what it does. Next, we're going to discuss Millennium Physicians Group that has over 750 providers using CallMyDoc in a variety of different ways. And we'll talk about why they're doing that and how they're doing that. Then we'll do a brief demo, different aspects of it, and how it works live. We'll talk about pricing, and then we'll take questions. Well, first of all, CallMyDoc has been in business for 10 years. CallMyDoc has handled over 10 million patient calls to date. We currently handle about 450,000 patient calls a month. And we do that in 34 states, providing artificial intelligence-based phone services for 3.5 million patients. The idea has always been, what can we do to make it easier for doctors and patients to communicate with each other without a hassle? It's that simple. Now, it turns out that in order to do that, it's not a good idea to start with texting or start with all these other things. The best thing to start with, since 80% of any communications in any practice have something to do with the phone, is fix the phone issue first. And then we're going to add additional future-based features that won't be telephone-based, that'll be text-based, etc. But right now we're addressing the major problem in just about any practice in the United States. So what's the problem with the phones? Okay, the problem with the phones is that it doesn't matter what you do. You're never going to have enough people to answer every single phone call, even though that's an expectation of a lot of patients. In other words, you can't staff to have somebody sit in there just to answer every single phone call, or you go out of business. It's simply impossible. By using CallMyDoc, it smooths out the workflow about answering phone calls and dealing with callbacks and this and that, because it's automatically figuring out who the patient is, automatically transcribing it directly into patient cases that automatically go into the inbox of the person to work on those, thereby cutting out a huge amount of manual labor. At least 50% of the amount of work it would take to do the same thing with a traditional phone method is completely gone when it comes to CallMyDoc. CallMyDoc can also be configured to handle calls after hours. As a matter of fact, CallMyDoc can be configured to handle calls in just about any method that you can come up with. The reason why it's so popular to be used after hours is because there's an app. The app will push the message to a doctor, and they can click on it. When they click on it, they can see who the patient is, why they're calling. They could screen their own calls. There's a million different ways it can be used after hours. And also the app is now being used more by staff to work remotely, which we'll also touch on briefly in a little bit. So let's talk about MPG. Millennium Physician Group started in 2008, and they've currently grown to over 750 providers, primarily in the state of Florida. They're currently opening and acquiring new facilities in both Texas and North Carolina. They have an advanced technology group that reports to the CIO, and the idea is that basically anything that they can do to streamline the operations to deal with more patients with the same level of staff in an efficient manner that makes the patients and everybody who works there happy, focused on. And so that's why they've chosen CallMyDoc to be one of their standard things that they offer and install in every single office that they have. So as I mentioned before, 80% of all communications with any practice have to do with the phone. there's a variety of reasons for that. One of the biggest is just people's default behavior. In other words, you could try to force patients to use the patient portal or other methods to communicate with you. They're simply not going to do it. Part of the reason is because maybe they don't remember their login or the URL for the patient portal because they only use it once in a while. Or maybe it's for other reasons that they can't figure out how to install the app on their phone if you have an app. I mean, there's a zillion different reasons. But at the end of the day, people just want to pick the phone up and get somebody at your practice and talk to them. And you can't get them to stop that. It hasn't changed during the last 10 years we've been in business. As a matter of fact, in some ways it's even increased. For instance, especially during the pandemic, we were handling anywhere between 4 and 5 times the number of calls per month we handle now because there wasn't anybody answering the phones. So this whole phone thing isn't going away anytime soon. The only way to fix it is to provide a tool and technology that makes everybody's life simpler in dealing with the fact that everybody has to deal with a large call volume, and that's just how it is. So this is an interesting chart. Let me explain this a little bit. In red is how long it would take to be able to listen to specific question types. In other words, since we've handled over 10 million patient calls, we've analyzed on a per question basis, in other words, for billing, clinical, medical records questions, etc., what's the average length of a question? And it turns out when you average all this stuff out that the average length of a question is about 24 seconds. And listening to it takes you about 21 seconds, period, plus or minus. In other words, that's the amount of time it takes you to listen to it. Forget about looking up the chart and doing a bunch of extra things. It's straight listening versus the stuff in blue is reading, okay? So in other words, each question type on average generates 54 words, and the average reader can read those words in about 4 seconds. So at a minimum, what you're doing is dropping something that took 22 seconds down to 4 seconds per call. The other thing CallMyDoc is doing in addition to this is figuring out who the patient is based on that when they put in their date of birth and this and that. So it's actually even higher than what's written down on this particular chart. The net result is everybody's happy. And by that I mean if you take all the bars between 5 minutes and 8 hours and you put them end to end and stack them up, and you took the other bars that are over 16 hours, the bars between 5 minutes and 8 hours would be higher than the other one. Short answer is this graph is measured by the time we transcribe a message to when it's closed out in the EMR. And that means that this is the response time to people getting back to patients. So most questions from any patient, period, are handled in less than 8 hours. Improving patient response time and making it much easier for the staff to be able to handle these things and get back to people. Now, when it comes to after hours, approximately 50% of the amount of time it takes to deal with calls after hours is gone by using the app. Okay, the way it works today is the doctor gets a call out of the blue. They have no idea what's about to happen to them. They have 2 choices: answer the phone or don't answer the phone. They have to write this stuff down. They have to remember to tell the staff when they get in the next day. I mean, it's just insane. CallMyDoc doesn't push a live call into your lap. It gives you a heads up, like caller ID for patients. Who's the patient? What are they calling you about by displaying the demographics of the message? Self-documents every phone call by itself, and you can leave notes for the staff automatically that go into patient cases. And huge amount of work just went out the window in terms of having to deal with those types of calls. Because of that, in general, CallMyDoc makes the response time to after-hours calls much more simple and rapid than any other method today. So to summarize, Millennium measured, and we've measured with them, that 80% of patient communications have to do with the phones. With CallMyDoc, you have the ability to prioritize which calls get answered by a live person, which ones get transcribed. When they are transcribed, they're tracked and managed, and I'll show you in the demo all the different things that it can do. And using CallMyDoc, MPG improves the productivity of their staff by at least 5 times and reduces the amount of time it takes to deal with a huge amount of patient calls. Okay, so at this point, I'd like to switch over to do a demo. Let me just get my screen going here. Okay, super. So the way CallMyDoc works is you get as many phone numbers as you want. Every phone number can be programmed to do something different. Every phone number understands how to automatically categorize and transcribe patient questions into 1 to 12 categories, thereby mapping those directly into patient cases. Each phone number you can treat like a person, or another way to think about each phone number is it's a miniature call center just dedicated for that particular purpose. You can have as many phone numbers as you want, each of them dialed in to do exactly what you want. It's not tied to pricing. So what I'm going to do here is I'm going to call that phone number. Now, you could switch between different modes of operation automatically, or you could do it manually. For now, what I'm going to do is I'm going to switch it to just after hours mode, just to illustrate some things, because there's a huge amount of overlap between the daytime and the after hours. I'll just point out what the differences are. So when you're not in the office, you're going to be using the app. Now, when I say you're not in the office, I mean that literally for anybody. In other words, anybody can use the app. It doesn't have to be just providers on call. If you have staff that want to work remotely, they would be using the app. We do charge for providers. We do not charge for staff to use the app. So staff can use the app for free because, again, during the pandemic, people had to work remotely. And this is like, when your app is like having your phone system and your EMR in your pocket at the same time. So I'm going to call this number over here and pretend I'm a patient, and then we'll walk through some different things here, and I'll show you exactly what's going on.
Press 1 for English. Presione 2 para español. Please select one of the following. Press 1 for Sphinx Medical Technology Sales and Support for the CallMyDoc app. Press 2 Athenahealth Test Office. You have reached Athenahealth Test Office. The office is currently closed. If this is a medical emergency, please call 911 or go to the nearest emergency room. If you are an established patient or calling on behalf of an established patient, please press 1 immediately to be helped as quickly as possible. Please enter the patient's date of birth by using your keypad to enter 2 digits for the month, 2 digits for the day, and 4 digits for the year for patient's date of birth. You have entered September 18th, 1963. Please wait while we look up the medical chart for the patient. If you have a question about your bill, labs, insurance, or some other message for our office, press 1. If you have a question about your schedule or to request or cancel an appointment or get directions to your next appointment, press 2. If you have an urgent issue and need to speak with the provider on call, press 3.
I'm going to press 3 now and explain what's happening here, the difference between this and the daytime mode.
If you have would you like us to return your call to 310-402-5573. If yes, press 1. Please speak the patient's first and last name. When done, press any key. Then you will be asked for more information.
Carl Silva.
Now, please leave a detailed message with as much information as possible as to why you are calling, any symptoms you are experiencing, and any other information that would help us expedite this call. When done, press any key.
Okay, so at this point it's listening to me, and it's going to transcribe everything I'm saying directly into a patient case. It's also going to push the transcription to the app as well, so we can look at both. Everything you heard up to this point, 99% of it can be customized to say and do whatever you want for your practice. And you can actually have multiple phone numbers, each of them programmed to set up to do different things depending on them to do to help deal with patient calls.
Once a provider or office has listened to your message, we will contact you at 310-402-5573. Thank you for calling. Goodbye.
It's already in the system. And click on load. Okay, great. So just a little bit here. When your calls get to CallMyDoc, so these are CallMyDoc phone numbers that we set up for you. In other words, they don't automatically, there's nothing magic here. It's a regular phone number. So the only time that CallMyDoc kicks in is when your phone system forwards a call to one of these CallMyDoc phone numbers, or the patients call the phone number directly. But when they do that, boom, we take over, and it can literally be programmed to do just about anything you want. When patients call in, they enter the date of birth because they have to. In other words, if a patient calls your office during the day and whoever answers the phone doesn't recognize the date of birth, they're going to have to ask them for their date of birth, right? We just do the same thing. I can guarantee you, if you could plug this in today or tonight or whenever, your patients would just start using it. There's no patient training here. There are two requirements. You have a phone, remember when you were born. Now, if there's more than one chart, we will ask for more information, but CallMyDoc currently handles 450,000 calls a month, and it just works. This isn't a startup. This has been around for 10 years. Once we figured out who the patient is in this demo setup, there's three things they can do. And again, don't forget, this can be changed or customized to be set up any way that you want. Now, the first thing is, people aren't calling your office for a cheeseburger. In other words, they're calling for the same stuff over and over again. I need a referral. I need a refill. I need an appointment, et cetera, et cetera. Well, these are the 12 different patient case types that exist in Athena. So the idea here is that a billing question goes right from the patient's mouth directly into the inbox of the person who's supposed to work on it, et cetera. And as I mentioned before, you can have a phone number or multiple phone numbers, any of them programmed for these different question types. The next thing when I called in is I had some questions about my schedule or I need an appointment. So we could do a couple of things here. First of all, if you allow patient self-scheduling through your patient portal, we can read those settings into CallMyDoc, and we can schedule the patient over the phone in 30 to 40 seconds. If you don't have your patient portal enabled in Athena for patient portal self-scheduling, then you could request an appointment, or patients can request an appointment, and again, we'll create a patient case for it. In any event, patients can also cancel their appointment, and we'll cancel their appointment in real time just like a person does, but also just like a person. As I mentioned before, if you have a 24-hour cancellation policy, and I try to cancel a half hour at a time and say, I'm sorry, we can't cancel that right now. Call the office back directly. And the third thing we can do under scheduling questions, if they forgot when their next appointment is, we could text or email it to them. And not only do we send them a text or an email, but there's a hot link they can click on, and Google Maps will give them step-by-step directions where they're supposed to go to get to their appointment. Now, the last question is because, again, CallMyDoc can be programmed to act like a person. So maybe you wanted to create patient cases using the usual provider on a patient's chart. Maybe you wanted to create patient cases based on the last provider that they saw. Or maybe you wanted to create patient cases based on one of these two. it can do any of that, and it can push it to any different office location or any different departments, et cetera, et cetera. So it just works. Now, what I'm going to do here is I'm going to show you something a little bit different. So if you're not in the office, for whatever reason, this is how you'd be dealing with the phone calls. Basically, you'd be using the app. How I get notified, when I get notified, for what types of calls I get notified is completely customizable. So this is an example of how I could be using the app after hours. It's also an example of how I could be using the app if I'm not in the office and I need to work remotely. Okay, so you click on the open session, and this is the way it works. It doesn't just throw a live call into your lap at 3 o'clock on a Sunday afternoon or whatever, because you could be in the middle of something else. Basically, patient demographics, transcription at the bottom. Now, our transcriptions are extremely accurate. However, you can't control how patients call you, because some patients may be calling you while they're riding a bicycle and eating a sandwich and juggling baseballs, who knows, and then talking to you at the same time. So you could still play it. But 99% of the time, it looks like that. Now, you can either swipe the screen like this, or you click on the records button at the bottom, and now I'm looking at the 3 most recent patient visits. I'm looking at allergies. I'm looking at active medications, and I'm looking at labs and other documents. Now, if this was an OB patient, it would also have that listed here. But if you click on any one of these little tabs, not only does it render the results of the OB episode information on the screen, but if you wanted to, you could print it on a wireless printer at home or wherever before you call the patient back. And so now I can either swipe again and hit take session. Whoops, I don't know why that shrunk. Oh, it got really tiny. That's better. Okay. So I can either flip it like this and hit take session, or I click on response and it flips it for me and I hit take session. You always have to hit take session, because it's going to document everything between take session and close session automatically by itself and put it back on the patient's chart. So if I hit this phone icon, the top number is the one I may want to get called back on. Remember when it called in and said, you want to get called back on such and such? The bottom numbers are their chart numbers. In case they screwed up one of their numbers, you could still use a number off their chart, but I'll just hit this callback number. Now, it's going to launch a real-time conference call between me and the patient.
Connecting you with the caller.
And now my patient phone is ringing, and that would ring with the caller ID of your practice or whatever caller ID you wanted to show to the caller.
Hello, this is Athenahealth Text Office calling you back.
And then we're connected. Super. Here's the thing, though. Not every call requires you to call the patient right back, or there are a variety of ways to handle these calls from the app, because the app, when I hit add response, this is all the stuff the app can do on its own. Call the patient, remind them to make an appointment, whatever I wanted to do, and I don't have to call anybody back. So let's just say this patient called about a refill, but I'm going to hit prescribe. I could pick one off their active meds list, or I could write a new prescription, but I'll just pick one from the list. And you have to tweak some of these fields because it's just how it comes out of Athena. What it's going to do is it's going to send this prescription to the pharmacy. Then it's going to update the patient's chart. And then it's going to call the patient and tell them which CVS to pick this up at. And I don't have to talk to anybody. I'm also going to have it call the patient and tell them something. I sent in your refill, but we haven't seen you in a really long time. So when you get a chance, could you please schedule a time to do a medication review? And then this little box at the bottom doesn't go back to the patient. This is for you to take notes about the call or to leave a note for the staff. It'll go back into the chart. It'll go back into the patient case, but it doesn't go to the patient. So I could do this. I sent in this patient's refill, but we haven't seen them in 3 years. So when you get a chance, could you please schedule for a medication review when you get in on Monday? And then when you finish, remember I told you always have to hit close session, so it'll document everything. But the other thing it does when they hit close session is now the app will do everything I told it to do. Like this. Hello?
Hello, this is Athenahealth Test Office returning your call. A patient at this phone number contacted us with a medical issue. We are calling back now with the provider's answer. If you are the patient or a HIPAA-authorized individual, press 1. Athenahealth Test Office has the following information for you. You can repeat this information at any time by pressing 1. Please listen to the entire message. This message has 2 parts. Part 1. The provider has prescribed the following medicine. Tazorac 0.1% topical cream. Every day by topical route. The prescription has been sent to the pharmacy. CVS 16050 in Target. Located at 3433 Sepulveda Boulevard. Please call the pharmacy to confirm it is ready at 310-370-1021. Part 2. I sent your refill, but we haven't seen you in a really long time, so when you get a chance, could you please schedule a time to do a medication review? Press 1 to repeat this information. Press 2 to confirm you heard this message. Do you wish to start a new session with the provider for another issue? Press 1 for yes. Press 2. Thank you for calling. Goodbye.
So you get your CallMyDoc numbers. Each one programmed to do whatever you want. When patients call in, they're going to use their date of birth so it can figure out who they are. And then it's going to ask them what they're calling about to categorize your question, and it's automatically going to push those patient cases into Athena. And if you want to use the app to work remotely or use the app to replace any out-of-hours answering service with something that's much more convenient, simple to use, and documents everything, you could do that. Now, this part here is what we call the admin panel. Now, there is a patient case in Athena, okay? Well, what I'm going to do here is I just want to illustrate something. So everything on this dashboard that has to do with patients is synced with the patient case. So if I put a note in here, the reason why I did that is just put my note and my name on that patient case. I'm only doing that to illustrate a point. That transcription's in the patient case. What we did is in the patient case. This note is in the patient case, and the session log details everything that occurred from end to end. This is not yet it's not in the patient case. There's way too much information in here, but this tells you exactly what occurred from what number they called in to when it was they hung up the phone. So if I take that patient case ID, I can put that in Athena and it'll take me right to it. It's going to take a second to bring it up because the test system for Athena is slower than a production system. Just give me a second here. Oh, there it is, finally. Okay, super. So here's my message. Now, I didn't have to do that. I just wanted to point it out. Again, you can have a phone number or multiple phone numbers or any combination of anything you want programmed to automatically transcribe in these different categories. We always take the patient's phone number down for a couple reasons. First of all, if you've been seeing a patient for a while, they'll go out and change their phone number, get a new cell phone or whatever. They'll never tell the front desk when they check in, which is how it is. Or maybe they borrowed somebody else's phone. So you got to take that number down. And this tells you where it came from. Because if you had more than one phone number, CallMyDoc number, this could have said Torrance Memorial Emergency Room. This could have said Refill Hotline. It could have said a variety of different things. And if we were just using it during the day, it would have stopped here. Well, we didn't use this. We didn't handle this call through the app. I guess is a better way to put it. So this could be just here. However, we did use the app to deal with it. And then there's the note. So, okay, great. Let's say I take care of this and schedule the patient and blah, blah, blah. Okay? Well, what's going to happen is when I close that, that's the same thing as if I clicked on archive here. because you can either archive it from here to close the patient case, or you close the patient case. It's the same thing as if I clicked on that blue button. Either one of those events says, okay, we're completely finished. Put everything about that call, any notes, any extra information, et cetera, back on the patient's chart under other documents, phone message, and here we are, with a summary at the top and the detail at the bottom. And you can't yet attach a voicemail to a patient chart. The thing that doesn't matter, because when you click on view original image, all these blue lines are hot links to the original recordings that we keep forever, and you can play them from inside the chart.
Okay, so at this point,
so what you wind up with something like this, which is basically a dashboard of everything that's going on. Now, again, this is Millennium. These are all inpatient cases. However, if there are other call types, you may have to check the dashboard for that, because you can't, unless you want to force everybody to always put in a date of birth, which you can't do for new patients or referrals, then some of them may be here, but we won't get into that detail. This is here because we support 15 different languages. And not only do we support those languages, but when somebody calls in Spanish or Vietnamese, it automatically transcribes it back into English before it pushes the patient case. Now, this, again, in metrics is because we track everything. So if a patient says they called your office 3 times on Tuesday, and they didn't call 3 times, and it's not here in a patient case, whatever, they didn't call 3 times on Tuesday, it's impossible. Or they hung up every time. If a stat lab result comes in at 4:55 on a Friday evening, it's going to be here or in a patient case. So these are the actual demographics of people that are calling in on somebody's behalf. We're currently handling almost 50,000 calls a month for them. This is the most important thing, or one of the most important things. That's measured from the time that we open a patient case to when it's closed at Athena. So that means that in general, these calls are getting handled in less than 8 hours, because it's still making everybody so much more efficient. They're able to return the calls in less than 8 hours. And this is just sessions, who's working on what kind of calls. So anyways, we go back to the webinar here. Just to kind of summarize a bit, after hours, CallMyDoc allows the providers, doctors to be way less stressed out, or not stressed out, because they're not getting a live call thrown into their lap at 3 a.m. They get a lot of information about the call before they even answer it, which is much better than anything else. Plus, it writes everything down. During the day, as I mentioned, you can have phone numbers that are programmed to do different things. So in other words, this is just a quick example here where you've got a phone number for each question type that this practice can get. And you can pick and choose which calls get answered by a live person, obviously, and which ones don't. Now, the phone system in green controls what's going on here. CallMyDoc just sits there waiting for the call. However, it always answers the call. If 400,000 calls or 40,000 calls get forwarded to that one of the CallMyDoc numbers, or 40,000 people call it, it's going to work always. It's never going to give a busy tone. So what you wind up with is something kind of like visual voicemail for patients. Very simple and easy to use. And key performance indicators about how well you're doing in terms of responsiveness to patient requests, etc. So just to explain a little bit more about this, we don't do one-time charges. So we will set up as many phone numbers as you want at no charge. And practices of all sizes use this, from one provider up to 750. You get a minimum of 30 days to test it out for free. Now, typically that means that it starts when you start using it with patients and it ends when you're happy, but it's very simple. If you decide you want to keep it, it's $129 for the first provider, $49.99 per additional provider, month to month, no long-term contract, no lock-in, no nothing, cancel whenever you want. And to get it free for no charge, to get it set up, you could fill out a consent form, or if you want, we could talk one-on-one. If you go to our website, CallMyDoc.com, there's more information there as well. And that's about it. I guess we'll open it up to questions at this point. And that ends the webcast. So we're finished.